Oh, hi, Mr. Jason. How are you doing?
I'm doing fairly
Good
well
to
today.
see you again. So, my name is Veronica Fortu, and I'll be your nurse for today, your nurse practitioner today. Okay, that means I'll be your provider today. So, do you know why you're here?
No. Oh, I'm getting physical.
Okay, you're getting a physical. Do you know the last time you had a physical done?
I think 1 month ago.
You did a physical 1 month ago?
Yeah.
Okay. Oh, okay, for your school, for your PE. Okay, now I understand. All right, so before we proceed, can you verify your names for me?
I am Jason Perez Fortune,
Okay, what's your date of birth?
April 26, 2006.
Great. So do you know what day it is today?
It is February 26, 2020.
Okay, do you know where you are?
I'm in a hospital.
Okay. Who's the president of America?
Donald Trump.
Okay, great. So the patient answers all the questions. That means the patient is oriented to time, person, space. He's oriented 3 times. So before we proceed, I'm gonna go wash my hands, right? So I've washed my hands and provided privacy and I made sure that there's enough lighting. And I saw that the MA took your vital signs. You know what your vital signs are? Your heart rate, your oxygen, and your respiration. And they are all normal for your age, okay? You're doing great, your blood pressure is great. I see that you're wearing glasses and your vision without glasses is 20/30. That means what the person, a normal person will see at 20, you're seeing it at 30. Okay, that's why you're wearing glasses. Did they ever tell you? So when you take off your glasses, you can't see, right?
Yes.
Okay. Alrighty. So I'm gonna be asking you some personal questions. So the general physical, we're gonna be checking your head, your toe, your eyes, your ears, your muscular, skeletal, your feet, your abdomen. Okay. The only part that's gonna be deferred is your genitals. We're gonna defer that one. Okay. And then, so I'm gonna be touching you. Is that okay? So if you become uncomfortable, you're in pain, you let me know. We can stop. We can take a break. Okay? Are you okay? You have any questions for me so far?
Not so far.
Okay, great. So I'm gonna be asking you some questions. Do you have any other medical issues?
I do have the occasional migraine.
Occasional migraines. And are you taking anything for that?
Some pills.
Okay, you take some pills, you don't remember what it is. Okay, so we'll look at your chart and we'll be able to tell. So, are you allergic to anything?
No.
Okay, do you know if you ever had any surgeries? Do you have any scars on you from
No.
any surgeries? Not that you know of. Okay, do you drink?
No.
Alcohol, drugs?
No.
Or you don't? Okay, do you smoke?
No.
You don't smoke. Are you allergic? You're not allergic to anything, right? Do you know if your mom, your dad, or grandma have any medical issues?
Not that I know of.
Okay. All right, that's great. So the whole family seems to be healthy then. Yeah. Okay. So I'm gonna be asking you now. So I'll be checking your head, your feet, and everything else. So I'm just examining you. You look well dressed, and the patient looks well groomed, and the patient is well nourished. It means you're eating well. And I'm gonna touch your skin. Your skin turgor shows that you're well hydrated. Okay, and your skin is warm as well. Can I see your fingernails? So I'm checking for capillary refill, blood return, and that's like 2 seconds or less, and which is great. Okay, so now I'm gonna be touching. Look, I'm looking at your hair. Your hair is well shaped, and your head is symmetrical. That means you don't have any deformity in your head, your ears. They all look the same. They're all normal. Look at your eyes, your nose, and everything looks normal. Nothing that stands out for me. You don't have any drainage and stuff like that. So I'm gonna be palpating your head, which means I'm gonna be touching and feeling for any bumps. If you feel pain, let me know. Okay. So, do you have any pain? Are you feeling any pain in your head?
No.
No, not at all? Okay, good. So the patient doesn't have any bumps in his head, nothing. While I'm here, I'm just gonna go ahead and just palpate your neck as well. I'm not feeling any bumps or any lumps Um, can you swallow for me? Good. So he has a good gag reflex. Um, then we're going to be looking at your eyes. So I'm just gonna check a little bit just to make sure that I'm not missing anything, okay? Alrighty, so we already talked about, okay, tell me, do you exercise?
Yes.
Oh, what do you do?
Well, I have school, so I go to PE, and normally we have certain, exercises that we do.
Okay, alright, good. So I already checked your nose, I'm not seeing any drainage in your nose. You don't have any cold or something like that, do you?
No.
Okay, so from now on, I'm going to looking at your ears. So I'm going to look inside your ears to see if they're normal, if I see any abnormalities, okay? So let me get my stuff ready. This is the otoscope, and we're going to be checking for your hearing. And I'm also going to be checking your hearing using this. But for now, I'm going to look inside your ears to see, we call the tympanic membrane in your inner ear, and see if it's clear or if there's any wax or stuff like that. So I'm going to pull your ear back and I'm looking. I see your tympanic membrane shining in gray. Just a little bit of wax in the opening, but everything looks great. And I'm looking. TMJ shining in gray. Tympanic membrane, I don't see any swelling or exiting. So just a teeny little bit of wax. So the ear cleans itself and the wax comes in the opening like external. So if you have time, you can just clean it, okay? All right, great. So I'm gonna be testing your hearing, and this is cranial nerve number 8. Has to do with the hearing. You don't need to really understand. So for the purpose of this video, I'm going to be testing cranial nerve number 8 in your hearing. So I'm going to strike this, and I'll put it in the middle of your head. If you feel the vibration on both ears, you let me know. If you don't feel vibration, you let me know. That means that's a problem, okay? All right, so let me know if you feel the vibration.
Yeah.
You feel it in both ears? Okay, so I'm gonna strike this. I'll put it in what we call the mustard area, the back of your ear. And so you let me know when you stop feeling, and then I'll put it in your ear, you let me know when you stop feeling. So what I just did is a Weber test. Now I'm gonna do what we call the Rainier test, okay? So I'm gonna strike this, and I'll put it in your mustard. Let me know when you stop hearing.
Right now. Right now.
Awesome. So the air conduction is 2 times longer than the bone conduction, which means it's normal. So I'm gonna do it on the other side. Let me know when you stop hearing.
Right now.
Okay.
Right now.
Okay, great. So air conduction is longer than bone conduction. Cranial nerve number 8 is intact. While I'm doing vibrations, I'm just gonna do vibrations in your bony areas. I'm gonna do it right here and also on your toe, right? Okay, you let me know if you feel vibration.
Yeah.
You feel it? Okay. And on your toe, do you feel it?
Yeah.
Okay, great. Alrighty. Now, cranial nerve number 8 is intact. I'm gonna do your mouth, okay? And I'm gonna have you open your mouth and say, ah. Okay. Can you wiggle your tongue? Ah. And the other side? Okay. You already swallowed for me. Can you swallow? Good. Alrighty. And I'm going to have you smile. Can you smile? Can you frown? Okay. Good. And can you open your mouth again for me? Checking for your, what we call TMJ. Close your mouth. Great. Any pain? Okay, I don't hear any clicking or clacking, so his TMJ is intact. It's normal. And so cranial nerve number 7, you just did this and you smiled and you're able to. So cranial nerve number 10 and number 7 is intact. Now I'm gonna be doing your eyes. Okay, so can you take your glasses up for me? Awesome. So we're gonna be checking for peripheral vision. When you see my hand, I'm not doing it yet. When you see my hand, you look straight at me or you look at the object behind me. If you see my hand, let me know, okay? And then we're gonna do what we call the extraocular movement of your eyes. So you're gonna follow my object with your eyes when we start. Okay, so look straight at me or you can look at the object behind me. When you see my hand, let me know. Okay, can you?
Yeah.
Okay, now I'm gonna do your extraocular movement and I'm gonna just follow this with your eyes, not with your head, but with your eyes, okay? Okay, great. So cranial nerve number 3, 4, and 6 is intact. Now we're gonna elicit papillary pupil reaction to light, and then I'm gonna be using the ophthalmoscope to check the red reflex in your eyes. So I'm gonna shine the light in your eye and see how your pupils react. And while I'm looking, I'm checking at right now at your eyelids. They look normal. I'm looking at your sclera. It's white. Your conjunctiva is pink in both eyes, which is great. So yeah, I'm gonna have you cover one eye, okay? And I'm gonna bring this light. Great, great reflex. And cover the same eye, and I'm gonna shine the red. Okay, great. Cover the other eye, and I'm gonna shine this light. Awesome. And I'm gonna bring it. We just initiated our pupil reaction to light, okay? And then I'm gonna use this. So elicit the red reflex in your eyes. So I'm gonna have you cover your left eye, and I'm gonna use you're covering your left eye, I'm gonna use my right eye. Okay. There we get the red reflex right there. Okay. Have you cover the other eye? Okay. And checking for the red reflex. Good. See the red reflex. Now, you did well. You can put on your glasses. Okay. Now we're gonna be checking. I'm gonna check your nose. I don't see any deviation in your nose. I'm gonna go inside and look at your turbinate and see if it's normal, if everything is good. Okay. Thank you. Check your nose, and this one goes awesome. So this, I'm gonna look at your nose. It's pink, it's red. Any pain? I don't see any swelling. Great. I'm gonna look at the sides. Your turbinate looks normal. It's not deviated. I'm not seeing any septal deviation. Turbinate looks normal. Alrighty, good. So I'm gonna have you take off your glasses so I can check your sinuses. Now let me know if you feel any pain, okay? So this is your frontal sinus, your ethmoid, and your maxillary. Any pain? No pain. Frontal, maxillary, ethmoid, maxillary. No pain, right? Awesome. Now we have done the upper part. We're gonna be moving downwards. Let me make sure I'm not forgetting anything. Alrighty, so I'm gonna be inspecting your neck, and I'm looking at your neck. I don't see anything that stands out, no nodules, no pulsation, and I'm gonna have you lay down so I can check what we call the JVP. It's a thing when you sit. Okay, so I'm gonna have you lay down, okay? Awesome. Alrighty, I don't see any, your JVP is not bulging, so it's not visible, not at all. So I'm gonna be palpating your mastoid area right here. Okay, any pain? No, okay, great. So I'm gonna have you sit so I'll be able to do your chest and your lungs and your breathing. Okay, so I'm inspecting your chest and it's symmetrical. You don't have no barrel chest, which means there's no deformity. Okay, your chest looks the same, posterior and anterior. Now I'm gonna have you, can you sit on here for me? Okay. Okay, so I'm gonna have you, what I'm gonna do is respiratory excursion. So I'm gonna have you take a deep breath. Take a deep breath and let it out for me. Okay, deep breath. Let it out for me. Great. So screw forward a little bit. So let's sit a little bit here. Okay, right, so we can see. So I'm gonna do diaphragmatic excursion. So right, I'm gonna have you take a deep breath, let it out, hold it. Okay, take a deep breath, hold it. Okay, all right, so between here and here, I can say maybe like 3, 3.5 or 4. So it has to be like 3 and 5 and it's 3, so it's normal. You doing okay?
Yeah.
All right, great. So I'm gonna do what we call tactile fremitus. So I want you to repeat after me. Say 99,
99,
99,
99,
99,
99,
99.
99,
Okay, I'm gonna do it here. Say 99,
99,
99,
99,
99,
99,
99. Okay, now I'm gonna do what we call CVA tenderness. Let me know if you feel any pain. Any pain? No pain? Okay, so he's negative for CVA tenderness. Alrighty, so I'm gonna listen to your breath sounds in your lungs, okay? So, anterior, here, 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 okay? And then in the posterior, I'm gonna be listening here, 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 and here. Alrighty. And then I'm gonna listen right now to your breath sounds. So the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Okay, and while I'm here, I'm going to be listening to Bruit with the bell. Aortic, pulmonic, Erb's, tricuspid, mitral. And I'm going to listen to Bruit as well with the diaphragm. Okay, I'm gonna listen to Bruit, your carotid rim with a bell, and I'm gonna listen to it with the diaphragm. Okay, no Bruit. Awesome. You doing okay?
Yeah.
Okay, great. So I'm gonna have you lay down and we're gonna do your abdomen. Let me make sure I didn't forget anything. Okay, we're gonna be checking your PMI. So I'm gonna have you lay on your left side. Right. So the PMI is the feet intercostal space, mid clavicle. So feet, 1, 2, 3, 4, 5, and I'm gonna palpate. I'm palpating his PMI right there. Okay. So feet intercostal space mid clavicle. So I'm palpating it. Okay. Awesome. Great. So I'm gonna have you lay down so we can do your abdomen. Just lay down for me. You doing okay?
Yeah.
Dizzy? No? Okay. So I'm gonna be inspecting your abdomen. Is there any way you can lift up your shirt for me? Just expose. Yeah, you can just lift. Let me just see your abdomen. Yeah, you don't need to take everything out. Great. You're good. So I'm inspecting. It's smooth. I don't see no scars. I'm not seeing any bulging. I'm not seeing anything that stands out. So I'm gonna go ahead and auscultate in all 4 quadrants, doing clockwise. So we're gonna auscultate lower right, upper right, upper left, lower left. Vowel sounds tympanic and then normal. Great. I'm gonna lightly palpate your abdomen. Let me know if you feel any pain. Is that ticklish?
Yes.
Okay. Any pain?
No.
No pain?
No.
Okay, so I'm gonna do percussion. This my patient is so ticklish.
Yeah.
Are you still doing okay?
Yeah, fine.
Alrighty. So I'm gonna do a deep. Let me know. You feel any pain?
No.
Pain?
No.
Okay. Pain?
No.
Pain?
No.
Alright, so McMurray sign. Right now I'm gonna do this. Any pain?
No.
Okay. I'm gonna palpating your aorta. Right now. Okay, right there. And I'm gonna be palpating. Let me listen to breaths. I'm gonna listen to breathe using the diaphragm. So aortic, the radial, the iliac, the femoral, and the bell, radial, aortic, femoral, no bird, heard. Okay. I'm gonna palpate your liver. Your liver is right up. Any pain?
No.
Okay. I'm gonna palpate your kidneys. Any pain?
No.
Pain?
No.
Okay. Awesome. Okay. Okay, put on your shirt and just make sure we're still on track here. We just did your abdomen and we're gonna do we palpated your aorta. We're gonna do the abductor side and the serous side. So I'm gonna have you lay down, okay? Okay. So I'm gonna pull your leg up, bend your leg, okay? Abductor sound. Any pain?
No.
Okay. So this is the obturator sign and the serous sign. Lift up your leg. Can you put pressure? Try and lift it up. Lift your leg. Lift your leg. Okay. Lift your leg. Lift your leg. Okay. Try and lift it again. Okay. The serous sign. Alrighty. Good. So we did that. Are we still okay? So we did that. Alright, so we're gonna be doing your reflexes, okay? So you're gonna do your reflexes and then we're gonna do your reflexes and then we're gonna do your neuroscience. So I'm gonna have you sit up, okay, so we can do your reflexes. Just sit up. Alrighty, let me have your hand. Just relax. Relax your hand. your brachial, radial, um, biceps, relax, um, brachial, radial, reflex. Okay, good. Now I'm gonna have you. This is where the patella is. We're not really gonna see because you're sitting. You have to be suspended. Like your legs have to be suspended to see the patella. But this is what we do to initiate the reflex. I'm gonna have you sit on here so we can do your Achilles. So you're gonna sit and put your foot here, like this. Okay. So we're gonna. There you go. And I'm gonna do this. It's called the Babinski. All right. Okay, great. All right, and then why just sit on there for me? I'm gonna check your sensation. So this one is sharp and this one is dull. So this is part of your neuro exam, okay? So I'm gonna put it on you. You let me know which one is sharp and which one is dull. So when you feel it, close your eyes. Let me know.
Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay, good. We're gonna continue. So we're gonna do the finger to nose. So you touch my finger and touch your nose. Touch your nose. Okay, do the wrapping hand movement. Okay, I'm gonna have you stand for me. All right, let me take this out of the way. I'm gonna have you walk normal. We're checking your neurological. Okay. Turn, walk back. Okay, I'm gonna have you walk on your heels. Turn around. Turn around. Walk on your heels. Okay, walk on your heels. Walk on your heels.
Okay.
Walk on your heels. Turn around. Walk on your toes. All right, turn around. Then do heel toe. Heel toe. Heel toe. Turn around. Do heel toe. Heel toe. Okay, one foot in front of the other. There you go. Okay, do heel to shin. Do this. Heel to shin. Good. I'm gonna have you close your eyes. Put your hands. We're checking for the Romberg sign. Any dizziness? Are you dizzy? You feel like you wanna fall? No? Awesome. We're gonna be doing now your muscle strength, your musculoskeletal, and all of that. So I'm gonna have you stretch your hands forward, and can you do a shallow knee bend? Bend your knee. Okay. Can you do this? Do that. Wiggle your fingers. Wiggle your fingers. Have a seat for me. Okay. Can you do your head? Okay. Left. Head to shin. Okay. Backwards. All right. Try to resist. When I push, resist. Okay. Hold my hands. Pull. Push. Squeeze. There you go. Can you wiggle your toes like this? Okay. All right. So I'm gonna be palpating the joints, your joints. So I'm palpating your finger joints, your wrist, palpating the neck, your shoulder, your elbows, your knees, your hips, and your ankles, and your toes, and your foot. You did that. Okay. Awesome. Now we are going to, can you stand up for me? And I'm having you lay down. We're going to be checking for appendicitis, the pain of the appendix. And what we're going to be doing right now is called the McMurray. We're going to do the McMurray sign. And then we're going to do what we call the varus and vagus. And then, so the McMurray, I'm going to lift up your foot, bend it, and I'm going to invert it inward. Any pain? Outward? Any pain? Alrighty. And I'm going to do what we call the varus vagus. Almost like same thing. I'm inverting inward. Any pain? Outward. I'm gonna do the draw anterior. So I'm gonna pull your leg. Any pain? No pain? Awesome. And I'm gonna have you stand up for me. Okay, do the upper scratch test. So do this. Okay, good. Now the next thing we're gonna do is a drop arm. So put your hands up like this. No, try to resist. Don't let it fall. Don't let it drop. Don't let it drop. Okay? Okay. All right, I'm gonna do apprehension. So put your hands like this, and I'm gonna push. That hurt?
No.
Push. That hurt? Okay. So the next thing we call the tennis test. Testing for carpal tunnel syndrome. So I'm gonna tap. Let me know if you feel any tingling, numbness, tingling, numbness.
No.
You don't feel it? Okay. So I'm gonna have you do this. Hold it for a few seconds for me. Hold it, hold it, hold it, hold it. Any numbness, tingling?
No.
No? Okay, great. So the one thing I remember, I'm gonna check your pulses. I didn't check your pulse. So your pulses, have a seat. So this is the radial pulse, radial, brachial pulse. The femoral is right here. Popliteal, dorsalis, anterior, the posterior, dorsalis posterior. Okay, good. So I'm just going to look on and make sure that I covered every area. Are we still doing okay?
Yes.
Alrighty, so we did your eyes, your ears, your nose, your chest, your neck, your abdomen, your neuro, your heel, gait, and we perform. Okay, so do you have any questions for me?
No.
No questions for me? All right, your next physical is going to be in a year, or maybe when you go, what grade are you in now? 7th grade. So maybe when you get to 8th grade, you might want you to do another physical. So you've been great, you're doing well, and everything is fine. So thank you for coming. All righty? Okay. Say hi to your parents for me, okay? All right.